Okay, so if you had to put a figure on it, I'm sorry to put you on the spot here, but if you had to put a figure on it, how much is this sector underfunded by? In a perfect world, what amount of money would be required to actually make sure that every Australian had this mental health safety net? Not just psychologists, but counsellors, services available to them.
So at the moment, and I think this is a really great question to ask, there are so many aspects and factors of mental health care across Australia.
Mm.
And we know that currently the Medicare budgets for psychology sessions are woefully underfunded. To put a figure on that, we're looking at, tens of millions, if not hundreds of millions of dollars. We know that the government is able to fund these sorts of large projects. And we know that, particularly with some of the more recent horrific situations that has put a lot of scrutiny on the mental health sector, that
Yeah.
there needs to be large scale investment in the sector. So we need that rebate to be $150 per session for every client seeing a psychologist. We also need more investment in rural and regional areas. So we need to have incentives for psychologists to go to and stay in regional areas across Australia, because we know that these are the areas that are being underfunded. We know that there's not enough services in those rural and regional locations.
Well, let's see what's on the budget and then we'll talk soon. Thanks so much for your time.